Assalamu alaikum. Welcome everyone to World Pneumonia Day. Today we invite in raising awareness about one of the leading cause of mortality worldwide. Join us with Knowledge IUB in understanding, preventing and combating this respiratory infection that affects millions globally. What is pneumonia? And types of pneumonia, prevalence, signs and symptoms, risk factors, diagnosis, pharmacological treatment, non-pharmacological treatment, and preventions will be discussed one after the other. So, our first heading is what is pneumonia? Pneumonia is an infection that inflames the air sacs in one or both lungs. Infection in the lungs caused by microbes. It brings water into the lungs, make difficulty to breathe, and it interrupts the gaseous exchange in alveoli. Now these are the agents causing the infections. Bacteria, viruses, and fungi, all three can cause the pneumonia. The bacteria include, and the most common one is the Streptococcus pneumonia. Others are Haemophilus influenza, Staphylococcus pneumonia, Mycobacterium pneumonia, and atypical Chlamydia legionella pneumonia. The viruses include influenza, and the fungi that cause pneumonia include Aspergillus, Cryptococcus, Histoplasma, and Pneumocystis. Now moves toward the types of pneumonia. There are three types depending upon the part of area infected. The first one is bronchopneumonia, in which the patchy area spread throughout the lungs when we see through X-rays. Atypical pneumonia is concentrated in peripheral region, especially interstitium. And lobar pneumonia, in which the fluid localized to a single lobe, consolidation of a whole lobe, and tactile vocal phrenitis, more vibration from person back or repeating phrase. Now we will classify the pneumonia on the basis of their etiology. The first one is community acquired pneumonia, the most acute type and the most common type. Community acquired pneumonia is one of the most common acute infection requiring admission to the hospital. The common bugs that cause a community acquired pneumonia are Streptococcus pneumonia, influenza, Mycoplasma pneumonia, and now its dominant risk factors are age, smoking, etc. Now let us move towards the second type, hospital acquired pneumonia, which is resistant and virulent. Hospital acquired pneumonia spread when the patient has hospitalized within the hospital and the symptoms appear within 48 hours after administration of patient in the hospital. The symptoms appear within 48 hours and can be seen with X-ray consolidation patches appears. The hospital acquired pneumonia may be due to patient diabetes, more common in old patients due to use of steroids, due to infected IV lines, due to unhygiene, and the chest pneumonia. These factors cause the hospital acquired pneumonia within hospitals. Its symptoms will be discussed later with the other symptoms of the pneumonia. The bugs of hospital acquired pneumonia are Escherichia coli, Klebsiella pneumonia, P. aeruginosa, and Staphylococcus, and other anaerobes. Now let's move toward our third type, ventilated or ICU associated pneumonia. In ventilated or ICU associated pneumonia, the bugs enter within the body with endotracheal tube with the ventilator. The symptoms will also appear within 48 hours, just like the hospital acquired pneumonia. In this, the pneumonia patches will appear within the x ray. Its symptoms will be discussed later with the others. Now, our fourth type, the aspiration pneumonia. The pneumonia caused by the inhalation of eating things, the inhalation of food, drinks, or vomit into your lungs instead of being swallowed. It is an emergency condition which need to be treated. The steps taken are endotracheal tube insertion, suction of the lungs, and nasogastritis tube insertion. The causes of the aspirated pneumonia includes seizures, stroke, anesthesia, esophageal blockage, fistula, esophageal reflux, and neurological problems. The diagnosis of aspiration pneumonia is done through CBC, X-ray, blood culture, and the other tests. The bugs include are P. aeruginosa, Klebsiella pneumonia, and S. aureus. Its treatments need corticosteroids because it causes decrease of the oxygen within patients. Now let us talk about the prevalence. The estimated prevalence of the community-acquired pneumonia varies between 1.5 to 14 cases per thousand persons year and affected by geography, season, and population characteristics. It is more common in child. Approximately 150 million of new cases occur annually in the children. It is more prevalent in the children's. Now let us discuss the signs and symptoms of the pneumonia. The pneumonia patients suffer with dyspnea, chest pain, productive cough, pus, trouble breathing, high fever and shivering, fatigue, cold, and vomiting. What are the risk factors for pneumonia? The risk factors for pneumonia can include age, very young or elderly patients, weakened immune system, smoking, chronic disease like COPD or diabetes, or certain lifestyle factors such as excessive alcohol consumption or malnutrition. The pneumonia risk factors are more common among these persons. The immunocompromised conditions such as HIV, AIDS, or undergoing chemotherapy also elevate the risk. Essentially, anything that weakens the immune system or compromises respiratory health can increase the likelihood of developing pneumonia. The viral infection, environmental factors, alcoholism, malnutrition, hospitalization, smoking, chronic disease, weakened immune system, all are discussed. Now let's move to a diagnosis of pneumonia. The diagnosis of the pneumonia is performed by the following. The first step is a physical examination. The others are X-rays, CT scan, CBC, sputum culture test, and urine tests. In physical examination, we look towards the physical signs and symptoms such as cough, difficult breathing, blood in the sputum, and the pus. The CBC complete blood count may indicate pneumonia by showing elevated white blood cells, indicating an immune response to infection and a higher than normal level of specific type of white blood cells like neutrophils. Neutrophils level increase within the patients of pneumonia. However, a CBC alone cannot confirm pneumonia. It's typically used in conjunction with other diagnostic tools like chest x-rays and clinical assessment to support the diagnosis of pneumonia. Now discuss about the sputum culture test. Sputum culture test involves analyzing the mucus you cough up from your lungs. In case of pneumonia, this helps identifying the specific bacteria causing the infection. The culture allows lab technicians to grow and identify the type of bacteria present, guiding healthcare professionals to choose the most effective antibiotic for treatment. This test is particularly helpful in diagnosing bacterial pneumonia and determining the appropriate treatment therapy for the patient. The urine tests are also done. A urine test doesn't directly diagnose pneumonia, however, it is done in some cases of atypical pneumonia caused by certain bacteria like Legionella, Pneumophila, or Streptococcus pneumonia. A urine test might detect specific antigens produced by these bacteria, aiding in the diagnosis. This test is not the comprehensive for all types of pneumonia, so it's actually used in conjunction with other diagnostic methods like chest x-ray, blood test, and physical examination to confirm a pneumonia diagnosis. So it was all about the diagnosis of the pneumonia. Now let's move toward the treatment of the pneumonia. If a young patient is diagnosed with a pneumonia, what would its treatment therapy? The commonly treatment include antibiotic therapy. The other symptomatic treatment includes antihistamines, mast cell stabilizers, proton pump inhibitors, anti-emetic drugs, cholinergic agonists, and antipyretics. The antibiotic therapy continues for 7 to 10 days. We will usually give moxifloxacin 400 mg once a day as the first line therapy in the patients of pneumonia. The second line therapy includes ceftriaxone 1 gram intravenously plus amoxicillin. The symptomatic treatments include antihistaminics are added if needed. The mast cell stabilizers are used if there is a problem in respiration of the patient. The proton pump inhibitors are added because of the use of the heavy antibiotics. Antipyretics are added if the patient have fever. It is used according to the need. We can give Panadol 1 or 2 tablets according to the need. If the pneumonia patient also has the symptoms of vomiting or the nausea, he could be given antiemetics such as motillion, metoclopramide, ondansetron, granisetron according to the need. The mast cell stabilizer given such as montelukast, proton pump inhibitors, we have omeprazole, pantoprazole, esomeprazole, and the short acting cholinergic agonists are used for the vasodilation if there is problem in the respiration. The cholinergic agonists most commonly used are salbutamol and terbutaline. These provide the symptomatic symptoms of the pneumonia. Now let's move toward the non-pharmacological treatment of the pneumonia. So firstly, it's a commonly prescribed prescription of the pneumonia patient. We can see all the drugs we have discussed earlier are mentioned here. These include the antimicrobial therapy occur along with the symptomatic treatment. Now let's discuss the antibiotics used in pneumonia within the hospital acquired pneumonia, ventilated pneumonia and aspiration pneumonia. The hospital acquired pneumonia treatment regimen may be ceftriaxone once a day or intravenously 200,000 milligram or levofloxacin, cefepime, piperacillin, meropenem, ampicillin, sulbactam. These are used in within the methicillin sensitive Staphylococcus aureus. And the treatment of multiple drug resistance includes more than one drug, and these include vancomycin and one of the above therapy. And linezolid 600 milligram is also added with one of the above therapy. The ventilated pneumonia patients are also treated with the same regimen. In aspiration pneumonia, we used combination of 2 or 3 antibacterial drugs. These include piperacillin, tazobactam, flagyl, and vancomycin is also added. Or same regimen plus clindamycin if resistant, also add imipenem and doropenem. Now let's move about the non-pharmacological treatment. The non-pharmacological treatment for pneumonia typically focus on sportive care and lifestyle adjustment. Rest, hydration, and adequate nutrition are crucial. Using a cool mist humidifier, staying upright to ease breathing, and avoid smoke or pollutants can also aid in recovery. In severe cases, medical intervention is essential, but these measures can complement treatment. How can we prevent the pneumonia? The prevention of pneumonia include vaccine, good hygiene, avoid smoking, healthy lifestyle, avoiding contact with sick people, and environmental precautions. Getting vaccinated against the most common cause of pneumonia, such as the pneumococcal vaccine and the flu vaccine, can significantly reduce the risk. Good hygiene, regular hand washing, especially before eating and after using the restroom, helps prevent the spread of germs that cause the pneumonia. Avoid smoking. Smoking damages the lungs and weakens the body's defense against respiratory infections. Maintain a healthy lifestyle, healthy diet, exercise regularly, and getting enough sleep strengthens the immune system. And avoiding contact with the sick people if possible. Limited contact with individuals who have respiratory infections can help prevent the spread of pneumonia causing germs. The environmental precautions minimize exposure to pollutants, chemicals, and other substances that can harm the lungs and increase the risk to the pneumonia. So here is today's question. What are different types of pneumonia? Answer it in the comment section. And thank you all of you for attending the live webinar with the Knowledge IUB today. Once again, thank you all. Keep in contact with us and give us the valuable feedback. How can we improve our live sessions, our webinars, and make them more interested, more knowledgeable, more valuable to all of you? Must give us the feedback. Thank you all. Stay blessed and Allah Hafiz.